Hi, this is Change and Grow Wellness Show, the show for you, the busy professional who wants to live a healthier, happier life with increased energy and productivity. And I'm Jackie Grant, and I'm your host. And today we're talking about common ailments that physical therapists helps with and advocacy and why that's important. And today we've got Dr. Theresa Marko, who's a physical therapist. Welcome, Theresa.
Thank you. Thank you for having me.
Great. So, Theresa, let's start off with you telling us a bit about yourself and what made you become a physical therapist.
So I actually decided to become a physical therapist at the suggestion of my father. He knew that I was always good with my hands, even as a child. He kind of always asked me to press on him and push on him and do different things while he was lying on the floor and stretching him. And I just thought that sounded like something that I would enjoy, helping people, helping to kind of fix the issues that they present with. And it was just something I explored and I thought was interesting, so I decided to go into it.
Brilliant, brilliant. And Theresa, what is the difference between a physical therapist and a physio?
I know it's confusing. Well, in the United States, we like to be non-compliant, just like we like to not use the metric system. So it's essentially the same thing. It's just or else you decide to call it a physiotherapist, and we need to be annoying, so we call it physical therapist. And it is confusing. Whenever I travel anywhere around the world, I just say physiotherapist. Yeah, I think it has a nicer ring to it. I don't know who started it here to be different, but it is the same profession.
Yeah, I thought it was, but I wasn't really sure. Do you know what I mean? From what you do from your website, I was like really going, well, what's the difference? But yeah. Now you've explained.
I know.
Which is interesting. So what are most of the common ailments that you see and you treat?
So physical therapy as a profession has a lot of different sections. There's, like geriatrics, there's home health, there's inpatient if you were, had some sort of emergency, that you were like on a ventilator, like in the acute care setting. There's also pediatrics, there's orthopedics. So that's what I do. I do orthopedics and pediatrics. I started my career treating birth to 3. So I started treating babies, and I became a specialist in what's called early intervention. And it's a program in the States that if your baby birth to 3 has any kind of developmental delay, like they're not walking or crawling or sitting up, or you start to notice they're not playing with their toys properly, we have a program here in each state where you can get early intervention. So I'm a specialist at that. Then after doing that for about a few years, I enjoy working with children, but I did miss talking to adults and talking about, what movie have you seen, things like that. So I decided to venture off a little bit and start treating adults also. So now I treat adults. So really my practice is I can see any age. Sometimes I'm treating grandma. Sometimes I'm treating, our age. Sometimes I'm treating a 6-year-old or maybe even an infant. I change my, hat that I wear depending upon who I see. I became specialized in orthopedics as a board certified specialist through the American Physical Therapy Association. But as far as pretty common things that I see, I would say back pain. A lot of people have back pain. A lot of people have neck pain from sitting here at the computer all day. We use our phones. They say people have text neck now, things like that. Oh. A lot of people also have knee pain, going up and down stairs, or when they work out, their knee starts to hurt. So I kind of think of myself, and I try to explain to people that physical therapists, we're like mechanics for your body. If your car starts making a funny noise, you don't know what to do, you bring it to the mechanic. That's what physical therapists do. It can be, addressing injuries in orthopedics, but it can also be preventative. Say you want to go run a marathon. Maybe you should go for a tune-up to your physical therapist to see what's going on. Do you have any alignment issues? Do you have any strength issues? Physical therapists can be both preventative and rehabilitative after that.
Brilliant. So that's really good. So if you were going to do a marathon, or say like Tough Mudder, do you have that there?
Yeah.
tough mother or something like that.
Those are hard, yeah.
Then you go and check yourself out before doing one. That's a really good idea. I didn't even think of that. So yeah, that's amazing. So how does advocacy play a part in your practice?
So that was something that I recently got into. I took a class one day that really taught me about it. And you know, for me, I've been practicing now 19 years, and I know that every day I'm helping people, I'm making a difference in people's lives. They feel happier, they're able to play with their grandkids, they're able to go run that marathon, they're able to get up and down from the chair, you know, things like that. But then the class talked about, well, you're off in your own office doing this. Nobody knows what you're doing. People don't know what you're doing. And most importantly, legislators, people in the government really don't know what you're doing. So it was about access. The way the laws used to be is that here in the United States, you had to go see an MD first to get a prescription. So you had to go to the office, take time from your day. You had to pay your co-payment, you know, for your insurance or pay the office visit. Then you had to go to a physical therapist and start that process over, retell your story, you know, pay your co-payment, things like that. So one of the things I realized is we need to decrease the barrier to access to care. If you have, you know, a shoulder injury, you hurt your arm the other day lifting something, you know, it shouldn't be so hard that you have to go to the MD, you have to get permission, then you can go to a physical therapist. We are all now doctors of physical therapy. We are very equipped to assess and treat. And if it's outside our scope or our spectrum of care, we know enough to send you to someone else to go see an MD. Perhaps you do need that MRI, something like that, or you need a prescription for medicine. So reducing barriers and getting people to be able to, you know, get in the door and get the help they needed. It really just touched me, and I felt so bad that a lot of people just struggle. They struggle not being able to do things functionally. They say, oh, I can't walk more than, you know, 5 blocks. My knee hurts. They give up. Or they're in pain constantly. That's also just, you know, sad. Especially, you know, here in the United States, we definitely are having an opioid epidemic. People for a long time now have just been taking, you know, Vicodin, Percocet, and then we have all the opioid deaths and everything like that. So physical therapy, we are an alternative to, you know, non-pharmacological options that can help you. So I wanted to just try to help spread the word. And in part of that, we have to try to change the laws, some of the laws. Some of the barriers are the law. You have to work in the system. So I wanted to try to help change the system. So that's how I became involved in advocacy. And advocacy is on a state level and a federal level. So on a state level, I go to my state capital and I legislate for local laws within the state, and then federally, I try to go to Washington, D.C. and advocate there for federal laws that will affect us. And advocacy is really twofold. It's for the patients to help the laws be better for them, but then it's also for the profession. It's for the profession to try to make the laws help us also. One of the things that we are working on here in New York State is for patients, we're trying to lower the co-payment. In New York State right now, we are considered a specialist. So when patients come to us, they have to pay that higher co-pay, the specialist. Again, barrier to care. So we are trying to make us be the same price as a regular primary care, so that it's cheaper. So that's one patient-centered law that we're trying to change. On a federal level, you know, you probably heard about the rising cost of student debt. It's insane. The colleges are very expensive, and while we need to try to lower the cost of education and universities and colleges, there's a bunch of people that already have a lot of loans. So one of the things that we are trying to do federally to help the providers is we're trying to get physical therapists added to the National Health Service Court Loan Reprogram, which is, if I went to an underserved area where there's not a lot of physical therapy providers, I stayed there for 3 years, worked in that community in the underserved area, then I would get part of my loan forgiven. On that particular law, there's so many people that are added to that, but not physical therapists, many healthcare providers. So really, we're trying to help change laws to make things better for patients and better for physical therapists also. So yeah.
Well, that sounds good, because I mean, it's similar here. You have to go and see your GP first before you get referred to physio, unless
that's frustrating.
You want to just directly go yourself and then just pay. So yeah, it's similar here. And if you wait for physio, you'd be waiting for ages, basically, most of the time.
Yeah, and they also did a recent study where it talks about that if you had an episode of back pain, it was a long-term study. If you had an episode of back pain and you were able to get in to see a physio first, the whole healthcare system costs, it saves about $3,000. Instead of having to go to the MD, you get an X-ray, maybe you get a needless injection, things like that. We're just trying to make access and barriers. And I mean, I even know for myself, when you're hurting and you're sick, you feel a little confused, you don't know what to do, and you go to all these people and they tell you different things. It becomes frustrating.
Yeah, exactly. No, that's really amazing that you're doing that. So, Theresa, just to kind of go back to back pain, because that is, quite a significant one that a lot of people suffer from. I'm a personal trainer, so a lot of my clients have, lower back pain and come with that. What types of things can they be doing in order to, relieve that pain, or, actually make it that it's not a recurring thing?
Well, I would definitely say, obviously, I think that they do need to be assessed by a physio, because everybody's body is different and there's no one cookie cutter thing. That being said, I do think that there's a couple things over 19 years of doing this that I see always, that pretty much I'm always like, you should do this. One of the things is, if they're able to get down onto the floor, I love lying on the floor, just lying on the floor with your knees bent. The floor is so amazing. It's hard. It helps push your spine into a better alignment. Gravity helps to pull you back down to where your spine needs to be. From all the sitting and standing that we do, sometimes our lower back, the vertebrae, they just slightly get shifted a little forward. So when you lie down, it helps to pull you back. The other thing it does is it helps to loosen up your spine. If you could just gently move your knees back and forth a little bit, bring your knees into your chest. Just spending, 5 to 10 minutes on the floor really can help to loosen you up and fix your alignment a little bit. Another thing I'm sure you're familiar with is having a foam roller. And if you roll the middle of your upper spine on the foam roller, you don't really want to roll the bottom part of your spine because that's already in that curve. But the top part, our thoracic spine, we get hunched over, we get flexed, and we get all tight. So rolling your spine on the foam roller and just kind of rolling back and forth, even maybe 5 to 10 rolls, helps to open up your chest and your upper spine, which can take tension off your lower back. Another one, since you're already down on the floor, lie on the foam roller with your whole body, head to bottom, and just, put your arms out in a T shape, a Y shape, an I shape, and just, again, open up that chest, get your pecs stretched out, get your shoulders stretched out. One of the things also is just, it will help to kind of put your spine into a better alignment. So I'm a huge fan of the floor and using the foam roller to help realign you, because we do spend so much time at the computer, at our phone. Even for me with my clients, I spend a lot of time bent over, leaning forward, pressing on people, working on soft tissue. So even myself, I lie on the floor every day, use my foam roller, things like that.
Brilliant, thank you. So have you got any final thoughts for our audience today in terms of what you've been saying?
I would just say I do have on my website, if they want to go to my website, I have a pop-up window that will give you a sheet on tips on some pointers on how to sit at your computer that would maybe make you feel a little bit better. There's no one perfect way to sit, but just, you know, general neutral alignment of your spine can help you feel a little bit better. So I would welcome to that. It's, you want me to say it?
Your website is?
Yeah. Yeah, it's www.marko, M-A-R-K-O, physicaltherapy, all one word, .com.
Thank you. So thank you, Theresa. It's been really informative, you know, especially talking about back pain, especially talking about the advocacy and what you're doing, which is really amazing. Hopefully we get that sort of thing here.
Yeah.
That'd be so great. So thank you. And that's all we've got time for, guys. So thank you for listening or watching, and we will see you again.